What is chronic inflammation? Usually, when you get an inflammation on your skin, it presents to you in swelling, redness, bump, and a bit of pain, which goes away within a few days. This type of inflammation is called acute inflammation, and as the word suggests, it's acute, or in other words, short-term. The other type is the one that's called chronic inflammation. Hello everyone, welcome back to Think Good. In this video, we're going to talk about chronic inflammation and how we can cure it. So watch this video to the end, and if you're new to this channel, please hit the red subscribe button and comment below that you subscribed, and I will reply back. What is chronic inflammation? Chronic inflammation is just inflammation that lingers and doesn't go away. Inflammation results from your body's fight against various viruses, diseases, infections, among other things. When such injuries or illnesses happen in your body, the immune system triggers a release of many things, such as an antibody, proteins, T cells, and so on, to prepare for a battle against any intruding viruses, bacteria, etc. But in the case of chronic, it could linger over time. This shifts your body in an alert mode, resulting from your body's response to it. This process is usually only supposed to last a maximum of 1 week, but since it's chronic, it doesn't stop even after 1 week. And this could impact organs, tissues, body muscles, and so on. Common symptoms of chronic inflammation. Some of the most common symptoms of inflammation include redness, bump, pain, or swelling. While the same can also be true for chronic inflammation, the signs are a lot subtler than that of acute inflammation. Chronic inflammation's symptoms are very dialed down, and hence it often gets overlooked. But here they are: fatigue, rashes, abdominal pain, chest pain, fever, mouth sores. Everybody in their lives has gone through these symptoms many times now, and they usually get cured within a few days. But in case of chronic inflammation, they could last months if not years. So don't ignore the symptoms thinking they're ordinary. They're anything but ordinary, and if you don't get the proper treatment soon, this could get out of hand. What results in chronic inflammation? There's no simple way to explain this. A lot of things can trigger chronic inflammation in your body, but ones that are researched and more common are untreated injury or persistent infection. Chronic inflammation can also be a result of existing autoimmune disease. Exposure to industrial chemicals or pollutants over time could also lead to chronic inflammation. Also, you must understand that anybody who has these symptoms may or may not have chronic inflammation. One can have these symptoms without having chronic inflammation. Our doctors and researchers are yet to establish a proper underlying cause. Other factors that could also contribute to this condition are obesity, alcohol, chronic stress, smoking. Once again, these may not directly cause chronic inflammation, but these habits could contribute to the things that can actually cause chronic inflammation. So, what happens to your body as a result of chronic inflammation? Your body will go through a series of changes if you suffer from chronic inflammation. As a result of that, you may not be able to eat what you used to before. Let's check them out. Foods not to eat. Avoid white bread or pastries, as they are a refined source of carbohydrates. Red meat. Hot dogs, sausages, or any other processed meat. Any fried foods. Foods you should eat. Olive oil, which is very good for health. Tomatoes, fatty fish, nuts, leafy veggies, lots of fruits. Can chronic inflammation cause other problems? In a sense, no, but over time, yes. Inflammation is a natural process, and so it cannot be stopped completely. So the doctor's medicines will provide you with chronic inflammation are not a cure, but rather a medication that can help you manage and keep it under control. Since there's no permanent cure, chronic inflammation can indeed cause other issues if left unchecked after a couple of years. Let's quickly go through some of these. Heart disease, type 2 diabetes, obesity, asthma, cancer, rheumatoid arthritis, neurodegenerative diseases such as Alzheimer's. Chronic inflammation's cure or treatment. As you know by now, there's no cure for most chronic illnesses, and there isn't any one for chronic inflammation either. But this condition can be very well managed if you take the medications that have been described for you and keep other recommendations in mind. With that said, let's go through a few of your options when it comes to chronic inflammation treatment. 1. Steroid-based anti-inflammatory drug. When it comes to steroid-based medications, corticosteroids are among the most commonly prescribed medications for this condition. This drug suppresses the immune system to a degree, and since inflammation is a process that's heavily dependent on the immune system, it will be decreased as well. 2. Non-steroidal anti-inflammatory drug. Some of the common examples of non-steroidal anti-inflammatory medications are aspirin, Aleve, and Advil, and these are all corticosteroids. While they work, they've been linked to some long-term diseases, such as peptic ulcer disease and kidney disease. Only take these if your doctor prescribes them. 3. Supplements. If you're allergic to both steroid-based and non-steroidal drugs, or have some other health conditions, then your doctor may suggest supplements instead. This could be lipoic acid, fish oil, curcumin, among other things, and studies show that they actually can reduce and control inflammations to an extent. So friends, I hope today you learned many vital facts about chronic inflammation. If you still have any questions, please drop your comments. And if you haven't subscribed to this channel, please do subscribe and share this video with your near and dear. Okay, so it's time to say goodbye. Take care, stay blessed, and keep watching Think Good.